because our final guest is going to discuss how the metaverse will address very specific issues such as mental health, access to health without geographical limitations, as also as a virtual wellness and fitness, and how the metaverse is also going to connect people. It's a thing of the future, but it's not that long away. We have a fantastic guest speaker. Dr. Bertalan Mesko is a medical futurist. He's the director of the Medical Futurist Institute, analysing how science fiction technologies can become reality in medicine and also in healthcare. And joining us also today is Shashank Sridharan from Alliance Partners Health. Shashank, I know you've got some fantastic questions, haven't you, for Bertalan? So I shall leave the screen up to you two. Off you go.
Thanks, Emma. Hello, and thank you for joining us today. But Dr. Mesko, please, before we really deep dive, I really want to understand, is sci-fi really becoming a reality? Or is this what we call metaverse? What is it today? What is the metaverse?
Of course. First of all, thank you so much for having me. And it's quite a fascinating topic, indeed, the metaverse. Well, if I wanted to be as short as possible about it, I would say that just think about social media or social networking, but in the virtual reality. For many years, there have been head-mounted devices, headsets, that allowed people to get into the virtual world, meaning that they put on the headset and they can see a virtual realm in front of their eyes. They can't see real life, just the virtual world. They can walk around as avatars in that virtual world, and they can do things. But the metaverse is quite a new concept that was introduced by the CEO of Facebook, I think, last year. And I think it's a high-level concept around the idea that what if we could connect these individual people who are connected to the virtual world into one big network? What if we could allow them to share data, to access data in different forms, to interact with each other, not through social media websites, not through messaging services, not through video conferencing technologies, but through the virtual world? That's the concept of the metaverse.
I mean, it seems quite a bit. Is it going to be just more than a virtual poke? I hope it is not. But what does this place feel like? To just put yourself, immerse yourself, or is it just like, you put something on and you get into this immersive world? What does it look like?
Well, I've been a virtual reality, a VR user, for short, a VR user for a long time. And I can briefly tell you my experience. I put on this headset, I click start, and then what I see is that I'm in a virtual space, a virtual environment that I can choose for myself. A building that looks like a building, but you can tell that it's not real because it looks like something out of a video game. And then you can do things. Some of us like to play games. I like to play mini golf, for example, in the virtual world. Others like to watch videos that look more three-dimensional than watching the same on a two-dimensional screen. It's hard to really describe what kind of experience you are going through while using a VR headset, while being in the VR world. Just imagine that you could do the same things on a two-dimensional screen. You could watch a video, you could play a game on your smartphone, on a tablet, on a laptop, on the monitor of your personal computer in 2D. In this case, it's not just that it's three-dimensional, you can even look around. And like in real life, you will see different parts of the world. It's not that the screen is going with you, you can look around in that virtual setting. That's what the metaverse looks like in action.
Seems like quite an endless possibility, It seems like the world has just grown more and more. But how many of us are really getting into this world? How many of us are using this as in the regular population, in and around you and me?
Well, this is the first obstacle, because for you to be able to get into the virtual world, you need a VR headset. And not only these headsets are really expensive, sometimes costing more than actually thousands of dollars, so really expensive. Plus, they are heavy. These are head-mounted devices, so for many, it will not be comfortable to wear them. And even if you have a headset already and you log into the virtual world, it requires a certain level of digital literacy, an ability to annotate while using an advanced technology. And when you log into a virtual world, you have to find out how to do things. There is no support, there is no help that you can get. It's not like you can ask questions while bumping into technical issues on a website, you are on your own in the virtual realm. That's why I would say there are not many patients, not many people being connected to the metaverse right now, even though it's true that there are more than, I think, 170 million VR devices that have been purchased worldwide. But still, I just want to make sure that it's a crystal clear concept for everyone that the metaverse for now is just an idea. If I can go a bit further than that, I think it's just a technological fantasy. It does have amazing promises. I mean, we can talk about the promising opportunities it can bring to the table, especially when caring for people, when caring for patients. But for now, it's just a technological fantasy. The headset is expensive, and it's hard to get access to the virtual world, even if you have a headset at home. Headsets, of course, have been changing over time. Their price has been going down. Those devices have been becoming easier to use, maybe more comfortable to wear and a bit lighter, but still the whole metaverse concept has a range of issues and obstacles to overcome first.
I mean, that's how every technology goes through. You have these early adopters, and then it picks up a wave, and there it is, out there building new possibilities. But excuse the pun, is metaverse a possibility? Can it even come into healthcare? And if it does, what does this immersive experience have to offer the people who will be on there?
Absolutely. Even though I try to paint a bit of a pessimistic image about the near future of the metaverse, the reason why we can be optimistic about the fact that the idea that it will come into practice is that virtual reality, when used with individual patients, has been shown to be very useful in a range of treatments and medical conditions. For once, VR devices have been shown to be useful in treating phobias, in treating post-traumatic stress disorder, PTSD, and certain mental health conditions too, simply because you can help patients to get immersed in this virtual world. To give you a real life example, there are people who have quite serious fears against spiders. It's called arachnophobia. And there are virtual world programs where step by step, they introduce patients to larger and larger spiders. And just by taking them through the virtual world, they sort of get used to it. It's not as simple as I just described. It's a very long treatment program, but based on peer-reviewed evidence-based studies, it seems to be working. There have been great studies showing that if patients staying in the hospital for longer times, can use a VR device to fly over Iceland or swim in the ocean in the virtual world, even their pain scores got reduced, but not when they just started using the devices on their own, but instead it only worked when their physicians could act as a partner in the whole process. So essentially, a device, in this case a VR device, helped improve the doctor-patient relationship. So VR has amazing opportunities and potential with evidence-based treatment protocols and guidelines. The only reason to think that when the metaverse becomes a viable concept, then we have a chance to see how it could contribute to healthcare. But if I may go on just for a half a minute or so, we have to say out loud that the practical reality of the metaverse in healthcare is far away in the future. I mean, when it's even hard for patients and physicians to build relationships based on trust, empathy, and compassion through such video chat conferences or video calls that we had to start using during the pandemic, because that was the only way to provide or receive care. But even that one is hard for people while they are doing video conferences, even in their jobs day by day. Then imagine how hard it's going to be to help patients and physicians build relationships while their virtual avatars are walking in a virtual environment while they have a not comfortable, quite heavy head-mounted device on their heads at home or at the point of care.
Well, this is something, very interesting, but also, the theme that has been in this last hour or so, it's all about convenience. How does this headset play onto this thematic of, convenience and getting delivered to you, care delivered to your doorstep. Is this something that we see, like you getting care at where you stand, even though yes, you've got a headset on, but how does this opportunity lie ahead of us?
I think now using VR and the whole concept of the metaverse is very far from being comfortable. It's so much easier and cheaper and faster to get in touch with a physician through telephone or through a remote care, even telemedical service, even a smartphone app, than putting on a head-mounted device, logging into the virtual world, looking for a remote consultation there. It's so much easier to avoid that it makes quite a good case for the metaverse not becoming a real-life healthcare concept anytime soon. However, I would not be a good futurist if I thought that, well, the technology we have today in VR is the one that we will have 5 years from now. It's like saying that 10 years ago, after the first 2-3 generations of smartphones, we would have thought that, well, even in the far-fetched future, we wouldn't be able to develop such small yet highly capable smartphones that could connect ECG machines or other medical devices to the phone, obtaining data about patients that simply used to be impossible to obtain through handheld devices. And now I use a smartwatch that has an ECG functionality built in. I have a smartphone and have connected devices to it through 5G. So even millions of devices can talk to each other and share data within the physical building of a hospital. So I'm just saying that there is a chance that these technologies, these head-mounted VR devices, will get a lot more cheaper, a lot more easier to use, a lot more comfortable to wear. It's a technological concept and a fantasy.
It is a possibility, yes. And as we see this, in the light of health and our healthcare, would our doctors also be in a fancy avatar? And would they still deliver the same kind of care? How would that experience look like? What do you envision that to be?
Well, when I have to think about the actual practical uses of the metaverse, thinking about doctor-patient meetings, it's just so far away from being convenient, from being reliable technically, from being manageable, but there are other parts of other parts of the healthcare delivery process where I think the metaverse could have a shot. I think in medical education, the metaverse concept would be amazing to be used. Just imagine that many medics meet some patients during their years at medical school, and then they have to go out in real life in the practice of medicine and care for those patients without having enough experience in their background. What if we could allow these medical students to analyze, to examine thousands of virtual patients in a really real-life looking setting in the virtual world before meeting real patients? I think it would allow them to feel more empathy, to know the patient's perspective. There is a VR program that allows medical students to see what the patient perspective, what patients with Parkinson's disease go through every day as a healthcare experience literally from their point of view. That really helps improve the empathy levels for medical students. So for medical education, I think the metaverse has an amazing promise. Also for medical events, the metaverse would have a chance to revolutionize how we share data, studies, and information. Medical events have been the same for decades. People go on a stage, they present, PowerPoints, and they discuss the data, they publish these studies already. But there was an example from Brennan Spiegel, who in the United States gave a talk on a stage while having a VR device on his head, and all the attendees had VR devices as well on their heads. And what the keynote speaker did was that he presented the same data, but in a 3-dimensional virtual environment, talking about biological, pathological changes during a treatment on 2-dimensional slides is very much a different experience than showing those attendees, other physicians and researchers, what's going on in the cell, in a 3-dimensional virtual environment, like being in a nanometer-sized submerged the body. and this is the kind of experience those attendees had. So in these areas, I think the metaverse has a great promise for the near future, even the next couple of years. But for patients meeting physicians through avatars, I just don't see that happening yet.
Do you think, triage would be another area that could, benefit, like allowing you to explain how, where, and you would have experiencing pain, or like even find a way to, feel the person or empathize rather than just seeing yourself against a screen to say, yeah, this is where I could potentially feel pain. I do see that, this is something that you would add into it. But let's deep dive a little bit more into the main thing that we typically see in the healthcare business, the regulatories, the ethics, the privacy. What does safety stand over here? How do we adopt as governance, as governments, as regulatory boards to, these new technologies that, grow and mushroom quite quickly?
Well, briefly, it's a mess. Obviously, it's a very new advanced technology. Even the devices, different vendors don't even talk to each other. So if I buy one device from a particular company and I want to get into the virtual world of another company, I cannot do that. There are no healthcare regulations or medical guidelines for using VR devices in the metaverse concept. When we talk about using VR as a treatment option for certain mental health conditions or for reducing pain for patients staying at the hospital, again, there are peer-reviewed studies, clinical trials, medical guidelines for those, but not for the metaverse. However, again, as someone whose job is proactively look into the near future, there have been technologies like this, artificial narrow intelligence, wearable health sensors, portable diagnostic devices like a portable ultrasound device that you can connect to your smartphone. In the first months after those technologies became accessible, regulations were not ready. So it's we can expect quite easily that regulations will be ready in a few years if the metaverse concept can prove itself, can prove its worth, that it can contribute something new. It can value to the table in the healthcare delivery process. If it's just a tech that we can see in many other industries, then it will not have a place in healthcare. But that's a good thing that we have to go through that, because evidence-based medicine, the idea that only medical clinical evidence can lead to medical professionals using a technology while caring for a patient, must apply to using VR devices or the metaverse in general too. That's how medicine should work, even with artificial intelligence in the near future.
So if we were to say this, we see the pros, or rather, there's a lot of things to tackle and, get ahead. Where do you think it would be an experience, if I were a long-term medical, or a bedridden person, Metaverse seems to have quite a bit of opportunity to really be more empathetic given care. But who are the other type of personas do you see that could benefit, even from a provider perspective? Where do you see this, expand the horizon, if I were to put it across?
If I get to choose one field or one area, I would say rehabilitation. Rehabilitation of elderly patients after, for example, a cardiac attack. The VR environment, the VR experience is such a great source of motivation to make people exercise more, because they can do things maybe they could have never done in their real lives. And I've seen amazing studies showing that by giving VR devices to elderly patients, they were able to elevate the number of steps they took a day, the kind of movements they do around the day, because they could do bowling. They could play bowling together, which, because of their physical condition, couldn't do in real life. But the virtual setting was smooth enough that allowed them to have the kind of experience that they played that game that they didn't play for decades before, but they still moved and exercised more than before. And if a VR environment, a VR headset is needed for that, to make people exercise more, to have a more physically active life, count me in.
Definitely. At this stage, I would like to pass it on to Emma to see if we get some more questions from the audience.
Great. It's been amazing so far. Thank you so much. I'm really interested in listening to your conversation so far. And we do have some questions actually. So let's get to those too, Bertalan. And someone asked, what will the challenges? What challenges will the metaverse create for healthcare? What can you see coming down the line?
What a nice question to ask, because it reverses the point of view that the metaverse is useful. So if it is useful and we have to adopt it technologically, what are the challenges that it can make healthcare face? Well, one thing is definitely regulations. If the metaverse is a good concept and it contributes value to the doctor-patient relationship, then regulators have to find a way to make it happen. But when Mark Zuckerberg was taking part in a Senate hearing in the US, and one senator asked him how Facebook made money. Well, I started having doubts about how those policymakers could understand the metaverse, but let's be optimistic here. So regulation would be certainly one issue. Second would be, I think, a cultural component that even though the metaverse provides a good technological platform for patients to interact with physicians, neither of these stakeholders knows how to build relationships based on trust, how to experience empathy and compassion, because this would be a new mean of communication for them. Either medical professionals or patients have been doing this in person. That's the only model that we have been seeing in our lives. Now the platform, thus people should learn these new tricks and how to build their own relationships through this technological platform. And I would stop at these two major challenges.
Okay, and the nice question to follow up on that, even though you have answered it in part already, but maybe there's some other areas as well you could talk about, is the benefits. What benefits will the metaverse bring to healthcare?
Well, the benefit comes from individuals using VR devices, rehabilitation, improving mental health conditions, even treatments in those mental health conditions. But when the metaverse concept becomes real, if it does, I have to think about how the interconnected idea of those individual VR devices would have a benefit for healthcare. Maybe, if I can come up with a bold idea here, patient communities would have a skyrocketing impact because of the metaverse concept. Just imagine that now many patients feel that they can find peers who they can share and discuss their health issues, because those patients this experience they are going through, and they might have relevant piece of advice, but they do this through social media channels, sometimes a Facebook group or dedicated patient community sites. But imagine doing the same through virtual avatars, accessing data, information, educational materials, videos in a three-dimensional virtual environment. I can see that it would have a huge benefit for improving the patient experience, but still not for patients meeting physicians in the virtual space.
And just finally, if you don't mind, you mentioned a couple of times if the metaverse becomes real. So, I don't want you to put your money on the table here, but what are the chances of it coming real? What kind of percentages are we looking at, do you think?
I think in parts, it has become real already. I know it's a silly example, but I've been playing table tennis in the virtual setting because it feels great, and it feels like playing real table tennis, and I don't have anyone to play table tennis with. In the virtual world, I can do that, and there are thousands of players like me who play the same game, and there is a community sort of functionality in the game, so we can interact with each other, we can launch tournaments for ourselves. It's the concept of the metaverse, but in a table tennis tournament. So the metaverse is here already, but the metaverse concept that companies like Meta and Facebook try to sell to us is a bit far-fetched, because it means that instead of going on social media and checking people's feeds on Instagram or Facebook or LinkedIn, they would do the same, or YouTube videos, they would do the same, but in the metaverse. I think it's a bit far-fetched due to the expensive nature and those headsets being not so comfortable to be used, and having requiring a sort of technological literacy to be able to use them. For these reasons, I think this idea is still a bit far-fetched.
Okay, we'll leave it there. Gentlemen, thank you so much. Bertalan, thank you. And Shashank, thanks as well for some fantastic questions. It's been an absolute pleasure. We really appreciate you spending some time with us today. Thank you.